Hi there. I'm so excited to welcome you to the Arthritis Life podcast, where we share arthritis life stories and tips for thriving with autoimmune arthritis. My name is Cheryl Crow, and I am passionate about helping people navigate real life with arthritis beyond joint pain. I've been living with rheumatoid arthritis for 20 years, and I'm also a mom, occupational therapist, video creator, support group leader, and I created the Room to Thrive self-management program. I am so excited to help you live a more empowered life with arthritis. We're going to cover everything from kitchen life hacks to navigating the healthcare system to coping with friends who just don't get it. Seriously, no topic is going to be off limits on this podcast. My interviewees and I share our honest stories of how chronic illness affects our lives. This includes discussions about mental health, sex, shame, pregnancy, body image, advocacy, self-acceptance, and so much more. You'll hear stories from all ends of the spectrum, from a person who's living in medicated remission from psoriatic arthritis to somebody living with severe mobility restrictions and severe pain from rheumatoid arthritis. You'll hear how people manage their conditions in different ways, like medications, mindfulness, movement, social support, work accommodations, and so much more. You'll also hear from rheumatology experts who just get it. We'll dive deep into the science behind chronic pain and what's the latest evidence for lifestyle changes that can help you thrive with arthritis, including exercise, sleep, nutrition, stress reduction, and more. This is your chance to sit down and chat with a friend who's been there. Ready to figure out how to manage your arthritis life? Let's get started.
Welcome to Rheumer Has It, the podcast that busts myths, highlights evidence, and inspires hope for living better with rheumatic disease.
Through plain language interviews with experts, we offer actual knowledge so you can thrive today.
My name is Eileen.
And my name is Cheryl.
Join us as we bust myths and spotlight evidence.
Yay! So today is a duo episode, just Eileen and I, and we are going to be delving into the role of what's called the multidisciplinary team in rheumatic disease. So multidisciplinary team means everyone beyond your doctor. So that could be, or rheumatologist. This could be occupational therapists, include people like physical therapists, psychologists, social workers, pharmacists, nurses, and more. And the reason this is important for us to highlight is that there's so much evidence that many of these professionals can help people with rheumatic disease, not just from the scientific evidence, but also from Eileen's and my personal experience. But there seems to be so many patients we encounter who are like, I didn't even know these other professions existed. And just to put a number to that, when I went to the 2026 American Occupational Therapy Association conference in Anaheim in April, I went to a really great session in terms of it was an updated 2025 guidelines for rheumatic disease and care for occupational therapists. Guidelines for rheumatoid arthritis and osteoarthritis for occupational therapists. And it was all this wonderful evidence on how our interventions can help people. And then I said, well, only 10% or less of patients have even been able to receive support for self-management or attend a self-management class. And I had a little bit of self-management, by the way, is the learning how to manage the day-to-day of your chronic condition. And I had a little bit, as Eileen can attest, and Lauren, who was with me, a little bit of a emotional response to that, because I really feel like I want to point out this problem, which is that not just related to that number of 10%, but just my observation in the patient community. It's very disheartening to me that there are 54 million Americans alone with arthritis, and so few of them are getting real comprehensive team-based support. They're all, just like myself, kind of given this diagnosis and then thrown out to just go figure it out on their own. And I was really feeling emotional and frustrated about that at the conference. And I even went up to the microphone and said, what are we missing here? Why are we not we're failing these patients as a profession. And it doesn't matter. It's like we've built this beautiful house, like our interventions, what we know works. We built this beautiful house, but we didn't invite people in. In the entire conference, there were like 78 presentations about stroke and less than 8 about arthritis. So I was feeling a little frustrated by that. But again, I always want to be part of the solution, not part of the problem. So obviously, I've known this problem existed for years. That's why I created my Room to Thrive evidence based self management program and try to make it really accessible to anyone worldwide rather than having to work with the traditional insurance model. But today, that's my little rant. But today, we want to just take the time to highlight the role of other professionals, not only your rheumatologist on your care team. Eileen, what else would you want to add to that? I first say
Yes,
dietitian. Sorry, that's the one I
that's okay.
forgot.
Yeah. As a patient living with two rheumatic diseases for over 11 years now, I've had to see quite a few different doctors, and they've all helped in different kinds of ways. And over the years, I've kind of come to learn how important the other people on our team are than just, well, as I refer to my rheumatologist, the head honcho. But it wasn't even just my own personal experience that I've discovered this, but I've come into a lot of contact with allied health professionals, either through my involvement in research or I've just met them through the work that I do. And there's a lot of reasons why people like that 10% have only gone to self-management classes, and being involved in research, I've actually learned a couple of the reasons being the cost of them. Insurance doesn't cost or cover a lot of these. Me being in Canada and in BC in particular, I'm very privileged to live near a arthritis clinic that I did have access to these allied healthcare professionals and was covered. However, that's not forever. It's not perfect as well. And, a lot of the other reason that a lot of patients haven't seen these is location. Think of all the rural population that doesn't have access to OTs or PTs, especially ones that even have the proper knowledge, experience to treat rheumatic diseases. That can be an issue. And then, of course, just they're not being referred to them, which is like, why? Or they just fail to kind of really understand what benefit they're going to get out of it. So there's a huge role to having allied healthcare professionals, but there's also a massive gap in patients receiving that care for a number of reasons. So, moving on into the first misconception that we're going to target today, and that is that our rheumatologists are the only one who can help us manage our disease. They're just, drug dealers. They don't help us in any other way. I've heard that comment before. Your rheumatologist is just your drug dealer. All they do is prescribe you medication, which is not necessarily true. They definitely can help with medications. That's a huge part of treating rheumatic diseases. But they can also listen to you and recommend other people who can help you manage your disease. And, that's including occupational therapists, physical therapists, social work, pharmacists. There's so many of them. PT is PT, I mean physical therapy or physiotherapy. We call it physiotherapy here in Canada, and it's different around the world. But basically, your exercise movement professionals we're talking about, and then occupational therapy. Those were when I was part of the 2020, was it 2022 or 2023? I never remember exactly
They
which year it was.
It's called the 2022 guidelines. Yeah, but they were presented a bunch in 2023, so that got confused.
Yes.
Yeah.
I was like, I know
Yeah.
I was involved in it, but I don't remember what year it is because they all
Yeah.
kind of mashed together. When I was involved in the integrative guidelines for rheumatoid arthritis treatment with the American College of Rheumatology, I was one of three patients that were involved in the whole process, and it was a very lengthy process. They went through all this literature and they had us do a voting thing. They had us do all these meetings and discussions. And there is a lot of professionals on there that, are pretty high up there in their knowledge about rheumatic diseases, or rheumatoid arthritis in that case. And they've been treating the disease for a very long time. And it was really interesting to me that physical therapy and occupational therapy were the two highest rated other types of care that we can get other than what a rheumatologist can offer. And they're the ones with actual evidence behind it. And then another interesting fact was that the Mediterranean or plant-based diet was the other thing that kind of had a lot of evidence behind it. So that was my takeaway from that is just, wow, physical therapy, occupational therapy, and mental health support was also there too. So important. But during that experience of helping with these guidelines, brought up so often was access to the care, being, referred to the persons that they would need to see was a problem, and just how important these guidelines are so that, our rheumatologist or maybe even our family physician can refer us to the right care team. And then also really exciting was when the EULAR, European Rheumatology Association, came up with their fatigue guidelines. That was really interesting. Can you remind me what year that was?
That was
2024?
2023. Yeah, the
Was that
EULAR,
20? Okay.
the management of fatigue in people with inflammatory, rheumatic, and musculoskeletal disease, and we're linking all these in the show notes.
Yes. So they're definitely something interesting to go through, but again, in those guidelines, PTOT help, mental health support help, and it is just so rewarding to see that particular symptoms like fatigue are starting to get recognized and there's actual plans on how to care for these pesky symptoms. So yeah, any additional thoughts on how
Yeah.
important the guidelines are and the role of, our interdisciplinary team?
If you have ever felt completely lost or utterly alone while trying to navigate real life with rheumatic disease, listen up. I am here for you. I created an educational program to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. And it's called Room to Thrive. After earning a master's in occupational therapy and completing hundreds of hours of additional training, I created a step-by-step guide to help you truly thrive with rheumatic disease. This is the only program I know of that's designed to improve quality of life for people living with inflammatory, autoimmune forms of arthritis, like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, non-radiographic axial spondyloarthritis, Sjogren's disease, and more. During the self-paced lessons, you'll learn how to manage pain and fatigue, cope with stress, navigate relationships, and continue doing the things that matter to you and bring you joy. The goal is really to help you improve your quality of life and learn how to thrive with your rheumatic disease right now, rather than waiting for a distant day when it might be cured or healed. I really created the down-to-earth, practical, heartfelt resource I wish I had had when I was first diagnosed at age 20. If you want even more in-depth support, you can join the 12-week Room to Thrive virtual support group, where you'll be surrounded by people who actually get what you're going through, people who will provide the encouragement, validation, and support that you deserve. Each group is expertly moderated, so you don't have to worry about the kind of misinformation that spreads like wildfire in the free-for-all social media groups. If you're on the fence, don't just take my word for it. Here's what Katie had to say in March 2023. I was lost and overwhelmed with my RA diagnosis. It felt overwhelming to know what to read, what to do, how to spend my energy trying to research on the internet. Room to Thrive did that for me. It's been like getting a crash course in my diagnosis along with a community who gets it. To see all the details, including the dates for the next support groups, go to the link in the show notes or bit.ly/thrive room with a capital T and capital R. You can also just email me anytime at info@myarthritislife.net. And don't delay if you're interested, because each group is capped at 16 people or less in order to make a small, intimate group atmosphere. Thanks so much for your time, and I can't wait to get started with the next groups. And I can't wait for those of you who are interested in the self-paced option to go ahead and join that at any time. Bye-bye for now.
Yeah, I would just say, I can speak now as an occupational therapist that professional guidelines are very critical for the practitioners, whether you're a physical therapist, a registered dietitian, occupational therapist, because that is, like you mentioned, you were part of them as a patient partner, that they're basically amalgamating all these different, randomized control trials and literature reviews and scientific evidence and saying, okay, there's so many tools in my OT toolbox that I learned in school or in my professional development. But when I'm faced, one-on-one with a patient, I need to figure out where am I going to get the most bang for my buck, and that's what these guidelines tell us. And they also tell us what's not helpful, right? So the 2022 integrative guidelines for RA recommended against chiropractic manipulation and against some of the other not diets that are not Mediterranean based. Now, this evidence is, science is an evolving process. So we always change the recommendations based on new evidence. But what I think is really helpful to know is, again, as a practitioner, these evidence guidelines are important. And as a patient, that, this is what you could bring to your physician to say, there's a lot, your own ACR, American College of Rheumatology, your professional association has published evidence that this multidisciplinary team can help me as a patient. Can you please refer me to an occupational therapist, a physical therapist? Unfortunately, again, I would personally say, this is kind of a strong statement, but I really do think occupational therapy and physical therapy, we have not done a good enough job, in my opinion, of promoting our professions to the referring physicians like rheumatologists. So it often at this time, it's not like a standard thing. You get diagnosed with RA and then you immediately get referred to OT or PT. That would be my dream, right? Every newly diagnosed patient gets referred to the multidisciplinary team, comprehensive, holistic, team-based care that's evidence-based, but it's not, because it's not quite there yet. It's there in some places like Hospital for Special Surgery in New York. There's a couple of clinics that are really good about that. But most of the time, as we often hear as patients, you have to be your own best advocate. You're going to have to be the one that asks for that referral. And so the second myth we wanted to talk about, just expanding more, you probably wonder, okay, you're saying these professions are helpful. What do they actually do? Well, sometimes if people are familiar with occupational therapy, they might think OT only helps people with hand pain, because traditionally with rheumatoid arthritis, the significant deformities associated with uncontrolled rheumatoid arthritis were really the biggest issue a lot of patients had before the current era of the medications that can really slow down the disease process. So OTs were utilized to help either post-surgery with hand rehab or just helping provide adaptations, maybe a customized splint and recommending a hand stretches and exercises. That's certainly part of our scope of practice, but that's one slice of it. The bigger pie is that our whole goal is helping you with your quote unquote, like occupations for us means your jobs of daily living, not just your job for money, but everything that's involved in your daily life and routine. That includes sleep, bathing, taking care of yourself, and the more complex tasks like managing your mental health, managing your social relationships. So, in managing your fatigue. And we are always looking at two different interventions. We're looking at either fixing the underlying problem. Let's say the traditional example is you're weak. Okay, we're going to help you strengthen, or we're going to adapt if the problem is not fixable. So you have a fixed deformity on your thumb. You're not going to get any more range of motion there. Can we create a customized, life hack gadget for you to be able to do your daily activities better? So that's just one of the myths we wanted to bust in this podcast, that OT is just about hands. I've heard actually rheumatologists, when they have heard about OT, they often just think we do hand therapy. So I wanted to bust that. What else would you share, Eileen, from your experience with OT?
Well, one of the things that I thought was quite interesting is I was involved in a paper kind of highlighting the useful role of OT for rheumatoid arthritis. And because I was a patient partner on that, I get emails from the publisher. So it was in Arthritis Research and Care. And I got an email saying that it was one of the most cited articles of 2024. And I think that really highlighted the importance of OT. And it was really interesting to talk about, why I thought OT is so important as a person living with rheumatoid arthritis. And before my diagnosis, I had no idea what an occupational therapist was. Zero. I'd never heard the word before. And so I went in there not knowing what they could offer me. And then I have come out years later and praising them to anybody who's been diagnosed with a rheumatic disease, because it isn't just the hand pain. Yes, the ergonomic supplies and devices that they can help us with, but it also was like managing our fatigue, knowing how to pace ourselves. I never really thought about pacing myself. I was always push through it, go. I didn't know how to rest, and they kind of remind me to do that. They pointed out that my fatigue wasn't just coming from RA, but also fibromyalgia, my mental health. And, they were actually one of the people on my care team that really focused on fatigue, where it often gets brushed off. You tell your rheumatologist about it, half the time they're going to say, oh, your meds, once they start working, they should be helping with that. Oh, your meds cause fatigue. And then it's kind of brushed off, and because they don't know what to do about it, right? So Because fatigue is I always call it my most debilitating symptom because it's always there and it's always strong. Pain is always there, yes, but it's not always debilitating, stop me in my tracks strong, where when you have fatigue, it's really hard to accomplish daily tasks. So an occupational therapist was the one who helped me kind of figure out how to do things that I have to do every day easier, like meal prepping, having, pre-cut vegetables or frozen vegetables, all these little things that add up into how they're going to help you throughout the day. It's really hard to actually put it in a sentence how they can help you,
Yeah,
but
I
can say
just
if
yeah.
you're struggling with your disease, they're a great person to see and have a conversation with and talk to them about how it's affecting you or in your daily life.
No, I think you explained it perfectly, and I would just add that if you are, you know, talking to a rheumatologist, the kind of quote unquote magic words, at least in the United States, for a referral for OT are often like, I can't function. I'm having difficulty functioning in my daily life. I'm having difficulty taking care of myself and taking care of the daily tasks in my life and or difficulty working, like difficulty parenting, and you can't independently do these things, that oftentimes can help the doctor write the referral. Depending on the
Mhm.
state you're in, you usually do need a referral for occupational therapy in the US. And one just really quick things, I forgot to put this in our myths and facts. For a lot of people are confused about the difference between PT and OT, so physical therapy or physiotherapist. Absolutely, there is overlap. I think a lot of times we have these in profession wars, quote unquote, where it's like, OT is different and we're so different than PT. No, yes, have differences, but I think it's important to acknowledge that there are overlaps, and especially when it comes to things like hand therapy. What's different is that the entire frame of reference for OT is really about customizing everything to your individual life context. It's not just within the body, but it's how your body interacts with the world. And the huge difference between OT and PT is that we can work exclusively in a mental health setting. PTs always are working in a setting that has to do with your physical health. OTs work on mental health too when mental health interferes with your ability to, again, perform your activities of daily living. So I did an internship in inpatient psychiatry at Harborview Medical Center working with people who are schizophrenic or majorly depressed or having delusions and stuff like that. And so that's a huge difference. We have questions on our board exam for that versus PT. So we are more skilled in the mental health, I would have to say. And we try to integrate that even when we're working with people who aren't necessarily getting the referral for mental health, we'll still integrate mental health. But anyway,
That's actually very interesting. I didn't know that,
yeah.
and I could definitely see that now looking back in my experiences with OT versus P. I've never really had my mental health totally covered by my physiotherapist.
Not
It's
to say some
yeah,
providers, you're gonna have providers that are very holistic in the PT world. It's not part of their direct scope of practice. They
yeah.
don't have questions on their board exam that are just about mental health.
Yeah,
Yeah.
I do know being involved in research with PTs and kinesiologists that mental health is being talked about and the
Yes.
effects of how it,
Yes.
is a huge barrier for us being physically active, worsens our disease. But yes, OTs have been the ones who have helped guide me through my symptoms of depression and how to get through those, like time chunking, just accepting what I can do, adapting in ways, things like that. It's really, again, hard to explain.
Yeah,
So
we have
yeah,
a PR problem in our profession, and many people have tried over the 100 years of our profession. Yeah. Okay, go ahead with the
yeah.
next misconception.
All right. So our next misconception and going on to the mental health topic, you have to wait until it's really bad before getting help from a counselor or a therapist. Well, no. The fact is, getting help sooner is far better. Patients don't get adequate mental health support. This is actually a study that I was involved with Arthritis Research Canada that highlighted that arthritis patients are not getting adequate mental health support. And what I thought was really interesting is that the last American College of Rheumatology conference, I attended a bunch of different sessions on mental health. That particular study done by Alyssa Howard, she's at Stanford and was at UBC before, and she is a researcher with Arthritis Research Canada. That study was quoted so many times at each session that I went to and in multiple times during sessions. So I thought that was really interesting, but also really sad. That evidence is there that people are not getting the mental health support that they need. And it's so important for them to do that because not only does it help with anxiety and depression, not everybody who lives with a rheumatic disease has anxiety or depression. They may experience moments of it, which mental health support can help, or, family, friends, support kind of thing, but they can also help with grief. And try and tell me one person who isn't diagnosed with a rheumatic disease that does not experience emotions of grief at some point, especially in the beginning. They can really help you understand it, help you get through it a lot quicker and normalize it. I remember when I was diagnosed, my emotions were all over the place. I didn't understand what I was going through, but it was my clinical social worker who was helping me with my mental health support was the one who said, "You are in the grief process." And then when I, dived more into what that was, I was like, "Oh my gosh, I am." And it was a lot easier for me to navigate it then. It was a lot easier for me to also explain to others what I was going through. And
Mhm.
so for a social worker, a lot of people think that they're just going to help you with paperwork and things like that. Or I was terrified of going to a social worker at first because I only heard about them when, you know, people were doing something bad. Their kids were going to be taken away kind of thing. So I was really worried of being open about how my disease was affecting me to this clinical social worker because I was like, it's affecting my parenting. Are they gonna have my kid taken away from me? Are they gonna tell me I'm a bad parent? It was opposite. They were actually highlighting how I was a good parent because I was trying and, you know, realizing that no one's perfect and giving me advice on how to, explain it to others and explain it to my kid and just focus on more positive outcomes than negative ones. So, Cheryl, I know that you don't experience depression yourself, but you do experience anxiety, and that often gets lumped together with anxiety. So, would you like to make a comment about that?
Yeah, I've often talked about how I only started going to therapy when I had postpartum. I did have postpartum depression, which I didn't recognize as depression at the time because I just felt like nothing, like nothingness. And I thought depression was like sadness. But then when I went to therapy, I ended up actually unpacking a lot more about my anxiety. And I realized that, in my training as an OT, I had been taught this, but I kind of forgot that depression and anxiety are a little bit on different poles and when it comes to different sides of an energy continuum. So with anxiety, I have a lot of energy, but it's anxious energy. So I'm like thinking of my brain is buzzing, every single possible worst case scenario, overthinking everything, monkey mind. Whereas depression is the opposite end of that spectrum. You don't have the energy, right? You have avolition, which means you don't have the gumption to take any action. Usually with severe depression, you're not activated. Whereas anxiety, it kind of hides in plain sight because people with anxiety like me often are doing a lot of health conscious behaviors. You're like, or healthy quote unquote behaviors. You're like, or things that might actually be helpful in certain contexts, like making a plan for a worst case scenario. So where you draw the line between, overthinking versus thinking the right amount, you know what I mean? But anyway, long story short, I just want to make sure to give voice to the experience of anxiety with chronic illness because I think, so often at these conferences and stuff, I just see stuff on depression or statistics on depression and anxiety. It is either not mentioned or it's just mentioned together with depression when really they're really different and they require different approaches because you need to activate someone with depression and get them to get up, get out of bed, do stuff. Whereas anxiety, you're doing the opposite, right? You need to make your mind less activated.
Mhm.
So anyway, I've had a wonderful experience with both a psychiatrist and a psychologist. Quick little misconception. I thought psychiatrists only did meds, but my psychiatrist does full hour-long psychotherapy sessions. And my psychologist is phenomenal too. So I've seen two of them. Yeah. Yeah. What else would you add to that?
Yeah.
But I'm on anxiety meds, which has helped too. Sorry.
Yeah, and for myself, I live with both anxiety and depression. I was actually diagnosed with clinical depression when I was 17, so it's had a major impact on my life and learning with it. And I'm very much one of those people that kind of needs to be activated because depression kind of makes me feel like I have a wall inside of me stopping me from doing things, even though I want to do them. And I think it's partially why we pair so well is that, you kind of push me a lot, sure. So that's always good.
We
And
counterbalance each other really well, I think, actually. Yeah.
yeah,
You help talk me down from my overthinking sometimes.
yeah, yeah. And you kind of stopped me from going too dark, let's just say. But yeah, I will also, because you did bring up psychiatrists, there are different kinds of mental health support. There's counselors, clinical social workers, psychiatrists, psychologists. Are all of them for you? Not necessarily. You might just need one, or you might need all of them, or you may want to try all of them. I personally saw a psychiatrist, and it was probably one of the worst physicians I've ever seen. But I only tried one, and I'm not going to lump them all together. Psychologist, I haven't really seen because I was seeing the clinical social worker, which is very similar. I can't actually tell you much of the difference. I think maybe probably just degree wise. And so it's really important to be able to see somebody that can prescribe you with medications if that is an interest to you, though. Because meds like Cymbalta or gabapentin, no, they don't work for everyone. They don't work for me. They have some negative side effects too. But for some people, they can really help with chronic pain, like fibromyalgia or nerve pain, which is really common with rheumatic diseases. And then it also helps with our mental health. That can help with fatigue and sleep. Being on SSRIs has actually helped me get more energy because I'm less depressed. It's not just that rheumatoid arthritis and fibromyalgia fatigue that gets in my way, but the physical symptoms of mental health also do it. And I sleep better also because I'm not as anxious, or I'm not sleeping, hours throughout the day, kind of thing like that. So seeing a mental health professional to get the right medications can also be just, I think, as important as getting the right biologics or DMARDs that we need.
Yeah, that makes perfect sense. And I think speaking specifically of medications, I would just say our last myth is really straightforward, but it's one that I only learned in the last 8 or 9 years, which is that I actually thought in the past you had to have an MD or be a doctor, which is MD or DO in the United States, to prescribe or help with medications. I thought that only doctors could prescribe, but actually it depends on the state and area that you're in, but nurse practitioners can prescribe in Washington state, at least. And in terms of helping you with your medications, you have pharmacists. Don't forget the pharmacists when you have medication questions. So many people, they wait and wait for the rheumatologist to get back to them because they're so busy and forget to ask your pharmacist questions about your meds, or your infusion nurse can also help you with questions. And I do have a couple questions or a couple episodes with nurse practitioners in rheumatology, like Dr. Corey Dewing and Kayla Alexander, and both of them they can see patients independently and be your primary rheumatology provider and prescribe you those biologics and everything in the United States, at least. And yeah, they may, whether it's a doctor or a nurse practitioner, they may also recommend supplements and things like that. So those are there's so many more myths and facts about all these professions. I mean, we should do a whole episode on just the differences, because there are big differences between the training for social workers versus psychologists and psychiatrists and stuff like that. That would be an interesting episode to do the delineation between the mental health and then what OTs can do mental health wise versus those other professions. But because it's time to wrap up, I would ask you, Eileen, in like we usually ask our experts, but in one sentence, what's the most important takeaway you'd want someone to take from this episode?
Be open to seeing different care providers on your team. And if you are not being referred to those, you can ask, because you do have to sometimes be your own advocate.
I love it. Just like it's not just joint pain, right? RA is not just joint pain. It's not just your rheumatologist that can help. They use other people too. So that's my last thought. Yeah.
Awesome. And, we did a session at ACR on that. So again, highlighting the importance of not just our rheumatologists on the team, but we have different other providers that we can see. So in that, thank you again for listening to another episode of Rumor Has It.
Yay. Don't forget to click the full show notes on the Arthritis Life website, myarthritislife.net, for a full transcript plus video of our conversations and links.
And also to say yay, because I love that response. We would also love to hear what you think about this episode. Shoot us an email or a comment on our social media accounts.
Yay. Thank you so much. And bye-bye for now. Thank you so much for listening. This podcast is supported by Room to Thrive, an educational program I created to help empower you to live life to the fullest with rheumatic disease.
In the program, you're going to learn evidence-based tools for managing all the ways rheumatic disease affects your life. And my goal is to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. You can go through the pre-recorded modules on your own in the self-paced course, or you can take the course along with a robust support group of new arthritis friends to support you and cheerlead you along the way. Learn more in the link in my show notes, or you can always go to www.myarthritislife.net. And if you like this podcast, I'd be so honored if you took the time to rate and review it. I also encourage you to share it with anyone you know who might benefit from it. I also want to remind you that you can find full transcripts, videos, and detailed show notes with hyperlinks for each episode on the Arthritis Life website, plus full episode videos on the Arthritis Life YouTube channel. If you have any ideas for content for future episodes, or you want to share your story on the podcast, please send me, Cheryl, an email at info@myarthritislife.net. I can't wait to hear from you, and thanks so much again for your time.